Shannon Welch from the Institute for Healthcare Improvement. Welcome to our virtual conversation series, Leadership Insights, where we talk with IHI's experts, partners, and leaders in communities. Today, I'm speaking with Andrea Gorey, Director of Mission and Community Health at Mercy Hospital, about the Community of Solutions skills, behaviors, and outcomes. Welcome, Andrea, and thank you for talking with me today.
Hi, Shannon. How are you?
Doing well. So honored to have this conversation. You and I have had the privilege of working together at the Oklahoma City County Health Department, where we had the opportunity to participate in the 100 Million Healthier Lives Scale Initiative through the Wellness Now Coalition, which was convened by the Health Department. The 100 M Lives initiative aimed to transform how the world thinks and acts about health, well-being, and equity. While the movement has come to an end, it lives on through the ways we work together with great leaders like you. Now, reflecting back and through the lens of your leadership role now at Mercy Hospital, can you share why the 100 M Lives initiative was needed and how it will have long-lasting impact on health systems or communities?
Absolutely. Shannon, there are many reasons of why it was effective, essential, and really significant. But what really stood out to me as a leader was really creating a mindset of abundance instead of a mindset of lack in our approach to our work with working with our community members and our residents. I really loved the fact that we really focused in on a on an abundance approach and saying, where's that untapped potential that's in the community, and how can we work together as leaders and with our teams to really tap into that and include community residents in planning and decision making.
Can you share some of the specific 100 M Lives approaches you integrated into your work, such as engaging community champions and people with lived experience?
In my mind, I always have LW toes, leading from within, leading together, leading for outcomes, leading for equity, and leading for sustainability. And one approach that I absolutely loved was really thinking on that leading from within, ensuring that we are taking time as leaders with our teams to really reflect on some of the work that we are doing and how are we approaching that work. And so I really loved Parker J. Palmer's and the Center for Courage and Renewal, their approach to habits of the heart. And going forward, that was something that I felt it was important for me to train our staff members on, was just the 5 habits of the heart. And then we also really integrated the approach of, taking time to reflect at the beginning before even starting our meetings by having quotes or, just different words or phrases that we can use to reflect on and get feedback from our coworkers and what it really means to them or what stands out to them. So we integrated that. And then we also integrated touchstones for collaboration. So our way of being together as a group, building a circle of trust and building that safe space, understanding that we're all in it together and that this is a safe space for us to really just dive into co-creating something new and something valuable to the community with the community.
I love that. I love that. So now, what are some of the strategies to engage community champions and people with lived experiences? And why is engaging people with lived experience so important?
So one of the strategies that we utilized was the approach for the community health worker model. And so community health workers, they're individuals who typically have lived or shared experience of the community or the population that we are serving. And so with integration of the community health worker model, this would ensure that community members have a voice at all levels, whether it's planning on a community level, working with leadership to really plan different programs or interventions, and then also having that ability to serve as an advocate at the policy level. So this was a significant strategy for us in the work that we were doing to improve health in our community.
Mm, wonderful. Well, you have so much experience in this. What can others learn from your experience?
You know what? I One thing that stands out to me that I learned while being a part of this initiative is not being afraid of failing forward. And so, as a leader, I strongly encourage us to, really work together to co-create something new, something innovative, and not be afraid to fail forward. And what that simply means is, if something doesn't work as we planned, let's learn from it and figure out how to adjust to that approach. Or, if it's something we have to scrap overall, let's scrap it. But let's not be afraid to try something different and fail forward if we have to.
The Community of Solutions framework and skills creates a culture of health and well-being, builds capacity for measuring progress, spreads and scales proof points, and connects technology and other supports to navigate to the things that work. In your leadership roles, you have helped integrate the Community of Solutions skills into your work. When you incorporated the concept into various programs such as the My Heart program at the Oklahoma City County Health Department. Can you share some insights and outcomes from that work? What advice would you give to an organization considering adopting and integrating these skills?
Absolutely. So, yeah, with the My Heart program, we had the opportunity to initially start with that program, but from us participating in the effort and learning more about community of solution skills, we were actually able to scale the community health worker model up in a few different capacities. We were able to integrate community health workers into our emergency departments through partnerships with three of our major hospital systems. We were also able to integrate community health workers within the criminal justice system in working with one of our programs to help with diversion of individuals who may be experiencing or diagnosed with mental and drug abuse issues. And so we were able to work with those individuals. We've seen a decrease in the number of sanctions that were being given. We also seen a decrease in the amount of time that individuals would have had to serve on their sentence due to this program and with scaling up those efforts. Within the hospital systems, we've seen over a $400,000 cost savings through cost avoidance. And so we were really excited. And from that program, our hospital systems decided to take on the financial responsibility for integration of community health workers into their systems. And now at Mercy Hospital, that's what one of the projects that I'm responsible for is integrating our community health workers, not only in our emergency departments, but within our clinics and within our population health division to serve our patients.
You started in your role at Mercy Hospital during the early months of the pandemic. The pandemic has brought into sharp focus many of the troubling things that we already knew about health disparities and racial inequity in the United States, but have failed to address. What lessons have you learned from the pandemic?
Many of the lessons that we are learning, as you mentioned, we've really seen some of our social issues become exacerbated. And we've also seen some of the, as a result of those social conditions being exacerbated, the health conditions of individuals have been exacerbated, which means they may seek care from our emergency department more than what they were previously. And so on our end, what we are really focusing on is what can we do as a healthcare system to really improve health equity on our end? What are some of those strategies? And I mentioned working with our community health workers is one strategy. We also have our community subcommittee of the board, and primarily this committee was made up of local leaders in the community. But one strategy we are implementing is how can we include some of our community residents to serve as community champions on this board as well. So that's one strategy that we're working on here at Mercy Hospital.
Over the last year, how have you as a leader personally adapted? What has tested you the most, and what practices have you relied upon to get you through?
As a leader, I've really worked to be intentional about reflecting on the work that we are doing within our hospital system, just with integration of our community health workers, and really being mindful that when we talk about diversity, equity, and inclusion, how that not only impacts our patients, but how it impacts our coworkers within the hospital system. You know, what we really know is that if we're able to support and provide the help needed to our coworkers who are serving our patients, then they can better serve the patients who are coming to us because because they don't have those stressors that they're having to deal with in life. So as a leader, I'm working to be really intentional on ensuring that our coworkers here within our program, our community health workers, have the support necessary personally and professionally so that they can effectively serve our patients.
How can public health organizations and public health professionals evolve to fundamentally transform the way health systems or communities think and act about health, well-being, and equity?
One thing that health systems can do to evolve is really take time to review what their own policies and procedures are around diversity, equity, and inclusion to ensure that across the board, they are able to provide the best working environment for coworkers within their organization. This is one thing, again, that we are really working on being intentional about is understanding that it starts within initially, but working within also impacts our community and in those that we're serving within our community. So being intentional about really just reflecting over your own organization as a whole, and then also ensuring that the community's voice is being heard to help us with systems improvements and within our own hospital. So lifting up the voice of our community as it pertains to the services that we provide.
Andrea, thank you for sharing your insights and lessons learned from our work in partnership. I'm grateful for the critical work you do every day to help improve the health and well-being of communities like yours in Oklahoma City.
Well, thank you, Shannon, for the opportunity.